Hello everyone, my name is student nurse Gator. I'm a third year nursing student at the University of Bahamas. Today for my family and community nursing class, I will be discussing a topic that's very underrated but very common in the Bahamas, chronic kidney disease. So pay attention. So I have a few objectives for everyone. By the end of this complimentary video presentation, a person should be able to 1. Describe the basic anatomy and physiology of the kidneys. Next, describe what chronic kidney disease is, also known as CKD. List some of the common factors that lead to CKD. Understand how CKD is diagnosed. Describe ways to prevent chronic kidney disease or the progression of chronic kidney disease. Lastly, understand how to manage end-stage renal failure, also known as ESRF. Now I have a little anatomy and physiology for you guys. The anatomy and physiology of the kidneys is very simple. They are two reddish-brown kidney bean-shaped organs that aid in homeostasis, which means they keep the body balanced and in a state of equilibrium. The kidneys are about 11 centimeters in size, and they have two ureters, which are tubular shaped that lead down to the bladder. On each side of the vertebrae, spanning from the 12th thoracic to the 2nd lumbar vertebrae, the kidneys are located. They are located retroperitoneally, which means that they are anchored to the back of the abdomen. The kidneys contain over 1 million functional units known as nephrons, with two main parts, the glomerulus and the tubules. So here's some physiology. The kidneys eliminate metabolic waste such as urea, uric acid, and creatinine, meaning that the kidneys filter the waste products of the metabolism. They manage fluid and electrolyte balance by wasting and reabsorbing, for instance, sodium, potassium, and chloride. The kidneys filter about 130 liters and excrete about 2.3 liters of fluid per day. Waste from the kidneys is excreted in the form of urine. Lastly, the kidneys stimulate the production of red blood cells. So what is chronic kidney disease? Chronic kidney disease is when the kidneys have reduced function for 3 months or more. Unlike AKI, acute kidney injury, CKD is irreversible and it gets progressively worse. It can be slowed with treatment. Each stage of CKD is determined by the deterioration of the GFR, the glomerular filtration rate. So what are the stages? Stage 1, which is pretty normal, the GFR is greater than 90 milliliters per minute. In stage 2, which is mild, the GFR is between 60 to 89 milliliters per minute. In stage 3, which is moderate, the GFR is between 30 to 59 milliliters per minute. In stage 4, it is more severe. The GFR is between 15 to 29 milliliters per minute. And in end-stage renal failure, ESRF, the GFR is less than 15 milliliters per minute.
I'm student nurse cadet, and I'm also a student at the University of the Bahamas, and I'd like to talk to you about the signs and symptoms of chronic kidney disease. Some of the signs and symptoms from earlier stages can also apply to later stages. With stage 2 CKD, commonly you would find hypertension, and this is throughout all stages. Hypertension, proteinuria, which is protein in the urine. When you would perform a urinalysis test, you would find that there's protein in the urine, and it shouldn't be that way. Hematuria, which is blood in the urine. Edema, which is swelling from fluids. It's trying to find a way to go somewhere. So, like with the kidneys, it gets rid of all the excess fluid. It can't find a place to go, so it's going to settle in the interstitial spaces of your body. UTIs, it's another sign and symptom of CKD in stage 2 CKD, and kidney disease that is visible on diagnostic tests. So diagnostic tests such as a CT scan or MRI can show how the kidneys are progressing and kidney damage. You may be able to see that on these scans. Also kidney biopsy, that's another way to tell if you have stage 2 chronic kidney disease. You should be able to find something performing a kidney biopsy. Stage 3 CKD, you would find urine discoloration, dark urine, it could be orange, red, same thing, hematuria. The person will feel lethargic, very weak, so they'll have like anemic-like symptoms. So remember the kidneys give off this hormone called EPO, epoetin, and it helps the bones to develop red blood cells. So of course you might develop anemic-like symptoms with decreased kidney function, sleep disturbances. Also, if you remember from the anatomy aspect of where the kidneys are in your lower back, you will definitely experience some lower back pain as well. Now, with stage 4 chronic kidney disease, signs and symptoms are going to get progressively worse. You're going to experience nausea, vomiting, loss of appetite, and as stated earlier, the kidney has nowhere to put all these extra toxins, these extra ions, this extra fluid. So your body's saying, hey, where you gonna put them? I ain't got nowhere to put them. I don't put them in your hand, I don't put them in your foot. Where we gonna expel them? You better stop eating. And that's exactly, your body is amazing in terms of trying to find a way to create balance or homeostasis. So with stage 4, you might experience bad breath or metallic taste due to azotemia. That's the toxins that accumulates in your blood. Of course, you're gonna feel fatigue, tired, run down. You're toxic. You're a walking toxic wasteland, basically, because you can't get rid of the waste, and you're gonna have a decline in mental function. You know, your brain depends on so many things, but if you have an excess of all these toxins in your body, you can't function, and you're probably gonna experience either urinary urgency, frequency, retention, most likely retention, because your kidney decrease in its function. So where is it going to go? You know, so you're probably gonna hold on to the urine. You're gonna experience muscle twitches and cramps because of all of the excess toxins again in the body. So many things are going to go wrong because your kidney's not working well. Okay, you're going to experience angina or chest pain due to the fluid accumulation, and I spoke about edema. And because the kidneys and the heart goes hand in hand together, all that's blood circulating, it's going to settle more around the heart than it is going to settle anywhere else. And of course, your extremities. You're going to experience shortness of breath because your body, again, trying to compensate. Where is it going to go? It's trying to get rid of the waste by all means possible. So it's trying to exert more and more. And you're going to experience sometimes numbness and tingling in your extremities. So now it's starting to affect your neurological aspect of your nerves. It's affecting everything at this point. So with end-stage renal failure, you might experience all the other symptoms in the earlier stages, including headaches, the color of your skin starting to change, pruritus, which is a medical term for itchy skin. So not only are you having shortness of breath, trying to get rid of it somehow, it's trying to seep out of your skin. It's trying to find any access point to exit or excrete those toxins. So you're gonna get itchy skin from that. Oliguria or anuria, which is a medical term for little to no urine output. At this point, your kidneys are functioning at less than 15 mils per minute, and now you're at a point where you're not going to urinate at all. You're going to depend on dialysis, and we're going to get into more detail with dialysis. I'd like to discuss how chronic kidney disease is diagnosed, and of course we spoke about the GFR earlier, and some of the lab tests that they would perform would include getting your blood drawn and analyzing some of the functionality of BUN, how it's wasted, how it's preserved. Same thing with creatinine. So they check your BUN and your creatinine levels, and your creatinine levels are very, very crucial in terms of how your GFR is functioning. So once the creatinine rises, and the normal range is, some persons are different, but about 0.6 to 1.2 milligrams per deciliter. Once that rises, your GFR decreases. And you know what happens when your GFR decreases? It means your kidney is not as functional as it should be. BUN, blood urea nitrogen, that's also a test that they use to evaluate the functionality of the kidneys, but this is not as definitive as the creatinine levels. Of course, the urinalysis can be performed to determine if you have protein in your urine, which it shouldn't be there. And the glucose, that ain't got no business being there. Okay, those molecules are way too large to be filtering through your kidneys in the first place, which means there's a damage to the integrity of the glomerulus, or how the nephrons are supposed to filter out your blood. Okay, so there's damage in that area somewhere. Imaging tests such as an ultrasound or a CT scan or MRI can show the level of damage of the kidneys, so you can see that on some of these imagery tests, and also kidney biopsy can reveal a lot about how your kidney is functioning as well. This is where we are starting to see why some people develop CKD. The risk factors. I'm talking about the risk factors. And with hypertension and diabetes, heart disease, obesity being a crisis in the small Bahamian community, these are some of the risk factors for developing CKD. And the reason why we develop these comorbidities or these, these diseases in the first place is because of our diet. We don't have the best diet. We like to eat our little comforters on the weekend. We like to go to the fast food restaurant any little chance we get, to a point where the traffic is in the road for the fast food restaurant. And that's what happens. We develop these diseases because of our lifestyle, our cultural aspects. And this is what makes us happy. This is what gives us comfort. The things we eat, this is what makes us happy. This is what makes us who we are. But at the same time, it's detrimental to our health. Another risk factor, it could be a family history of having a disease, a kidney disorder or acute kidney injury, such as polycystic disease, or that's a disorder, or history of kidney injury, whether it could be pre-renal, renal, post-renal, some kind of kidney stone that's blocking, urinary elimination. Age, of course, as we age, automatically our kidneys start to decline and function with age, so much as early as the age of 30. So with each passing year, we are unable to filter 1 milliliter less of what we were able to filter before in earlier years. Of course, diet. That's automatic. With poor diet, these other risk factors just sprout, and it gives way to chronic kidney disease over time. Diet is a huge, huge killer. Smoking, of course, and to be honest, what doesn't smoking cost? Okay, so I don't want to get in deep details with that. If you smoke, you should quit smoking. This is something that we can't avoid. As with age, more Blacks, Asians, and Native Americans are predisposed to CKD than with other races. I don't know why. Must see all the soy sauce and all the extra sodium we just have in our diet. I can't see for sure. And of course, I have to point out this with a lot of emphasis: abuse of medications. We, as the Bahamian people, we famous for getting over-the-counter medication for anything. You're mad at your boyfriend, drink some pills. You get knocked down by a car, drink some pills. You feel one little headache, but it ain't definitively a headache, but you feel like a headache coming on, and you just decide you want to drink some pills, drink some pills. You wake up in the morning, I feel like drinking some pills. I can just drink some pills. Let me just swallow some. Us Bahamians, we abuse, when I say use, we abuse Tylenol, Advil so serious, it's ridiculous, okay? And this, at the end of the day, they call them NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, which can potentially damage your kidney over time. Us Bahamian people, we need to stop doing that. Drinking over-the-counter medication for no reason. So that concludes most of the risk factors that could predispose somebody to CKD. Now I would like to talk about how to prevent CKD in 3 different stages. You have primary, secondary, tertiary prevention. And primary prevention is based on health maintenance, which is ultimately rewarding in all different aspects of life. And I want to use an analogy. So we have our vehicles, most Bahamians like to drive a nice little Honda. They put rims on it, they change the color, they get a detail, they check the inside, make sure that the engine oil levels are there, and to make sure that it has coolant and so forth. And similarly, we like to take care of ourselves on the outside. We want to, wear nice clothes, wear Remy, name brand stuff to look nice on the outside. But a lot of us neglect the inside. We eat garbage. We don't go and get ourselves checked out. So we don't know what's going on the inside, and it essentially affects the way we look on the outside as well, because most persons, they just focus on looking well on the outside. So yearly screenings aren't the worst thing in the world. I do them usually, and sometimes I find things that are a little off. And I remember doing a lab where my white blood cell was elevated, and 3 days later I got sick, but I already was prepared for something happening. I somehow got infected with, I don't know what happened. But it's still good to know your status. If you can do it every year, it'd be great, because if something happens, you will catch it and you can treat it. That's also a part of secondary prevention, but we'll get into that when I talk about it. Staying active, changing your diet, of course, quitting smoking if you smoke. And of course, as stated earlier, do not abuse medications. If you don't need it, your body is going to be affected by it one way or the other. Not just your kidneys, your liver, other things are going to be affected by the drug abuse. And of course, avoiding prolonged exposure for persons who work in certain environments that deal with pesticides and other heavy metals. Avoiding those types of environment would be good. Secondary prevention is when you are already like in an early stage of chronic kidney disease, or you're at huge risk for chronic kidney disease, which means you probably already have chronic hypertension or chronic diabetes. CKD is hard to avoid if you're not doing anything about it. So you have to take your medications as prescribed. You could change your diet and get more like strict by having like a low protein diet or low sodium diet, and doing more regular lab evaluations to ensure that your creatinine, your BUN levels remain within normal range. Tertiary prevention is based on managing uremia, which is toxins in the blood. And some of the actions include managing anemia. Of course, your kidneys won't be able to help you make blood the way you should. So you have to take artificial EPOs, preventing cardiovascular disease, because the cardiovascular system goes hand in hand with the renal system. You're going to need to learn how to manage your cardiovascular health, because you're prone to developing cardiovascular disease due to the renal failure. Preventing bone disorders is another way to monitor or prevent further damage because of end-stage renal failure. And limiting alcohol, as in you don't have to give up your whole life to survive. You can still enjoy a little bit of alcohol, just not as much as you used to if you were a heavy drinker to begin with. Exercise is tolerated as good because you sweat, you get rid of toxins through your skin as well. So it's still good as long as you can tolerate it. Care for your CVCs. So for persons who are awaiting an AV fistula or AV graft, which are like a surgical procedure to give you permanent access points to get dialysis, you need temporary access points while they develop, because it takes a while for those points to develop. You want to care for your central venous catheter, which can be either in your neck, your clavicle, your femoral access point. They have medical names. I'm not going to get into that. Of course, dialysis, once dialysis is performed through some of these access points, whether it's a CVC, whether it's an AV fistula or AV graft, and blood comes out of your body, the toxic blood goes into this machine that acts as your kidneys, cleans the blood, and returns the blood back into, and this can take anywhere around 3 to 4 hours to complete. And of course, really great option, but not realistic for everybody, because not everybody have that kind of money, a kidney transplant. But also kidney transplant comes with risk factors where your body could actually reject the kidney and you would have to go on immunosuppressants, and it can be very detrimental to the person in some aspects where you feel very, very weak on immunosuppressants. But other than that, it is still one of the best options, and this completes what tertiary prevention entails. Now we have come to the end of this video presentation. Chronic kidney disease is a huge issue in this country, but it's not talked about nearly enough. At least not as much as hypertension and diabetes, which are risk factors to developing CKD. Dialysis unit at PMH, or Princess Margaret Hospital, is always packed with people. People are always in those chairs. People are always in the waiting room, waiting to be put on dialysis, and even outside of the waiting room on top of that. So it's a very serious matter, and watching people get dialysis is a very sore sight for the eyes. So it'd be nice if persons would try to better care for themselves and prevent having to go on dialysis or prevent losing their kidney functions. Community health nursing is majorly based on caring for the public and trying to ensure that persons do not go to the hospital. So we try to teach you and try to help you to care for yourselves at home before you have to end up in the hospital. It has been a pleasure having this very meaningful conversation. Thank you for tuning in, and goodbye.